Alright, today's video is on what causes a heart attack. Got the heart model right here, and we can see the different chambers inside the heart, some of the muscle, and the valves as well. But really, a heart attack is dealing more with the arteries on top of the heart. Now, we call these coronary arteries, and they branch off the base of the aorta right here. And we have a right coronary artery and a left coronary artery and a couple other ones as well. Now these arteries supply the heart itself with blood. So if these arteries become blocked, then you're not getting blood to the heart muscle. And we can see some myocardium right here and over here as well. Lots of muscle, cardiac muscle of the heart. So we need to get blood and oxygen to those tissues. Well, imagine this artery, and this is the anterior interventricular artery, aka the widowmaker. Imagine that artery starting clear and then filling with fat, cholesterol, calcium, and just building and building. This is what we call plaque, and it gets really, really full. Blood is not able to travel through there very well. And this can be problematic when you're trying to get blood to the heart tissue. Now, this is a slowed down version of how fast blood would flow. Blood actually flows a lot faster than this, but look how much slower and tougher it is for the blood to get through the side that has the plaque. Well, another example is shown here. Lots of plaque, lots of buildup, tough to get blood through. However, that's not a heart attack. That would cause potentially some angina or chest pain, and a lack of blood flow to any of the tissues of the heart we call myocardial ischemia. Myocardial ischemia. But that's still not a heart attack. A heart attack is actual death or necrosis of the heart tissue. So imagine this tissue here, this myocardium, dying or shutting down, causing a lot of pain and a lot of issues, and very time sensitive. The dangerous part is that you could have a blocked artery like this or a blocked artery like this and not even know it. So what happens when someone's having a heart attack? Well, call 911, get them to a hospital, because there's a couple things they can do. Generally, it's also prescribed to give them aspirin. Aspirin is a quote-unquote blood thinner and helps get blood through a little bit quicker, but it only buys you time. Get them to the hospital, and they might do a couple things. They got to go in and they got to figure out what type of block it is, the severity of it. But they're either going to go in and imagine this, taking this probe or a tool and just cleaning that out so that it looks more like this. Then they put in what's called a stent or a metal cage, and they hold open that artery because it could have collapsed. That's what's called a stent. However, another option is a bypass. And if you've ever heard of bypass surgery, it's often abbreviated CABG. C-A-B-G, coronary artery bypass graft. And what that is essentially you take a graft or an artery or vein from elsewhere in the body and you graft it around the blockage. So let's say the blockage is right here, and you need to get blood down here. Well, there's oxygenated blood coming from the aorta, so maybe you put it right in here, and now you're going around that blockage. Okay, what are some common arteries to use? Well, actually, this one right here is a common one called the internal thoracic or internal mammary. And then we also can use the radial artery and the great saphenous vein, which is a vein in the leg. However, it's best to use an artery because you're replacing an artery. But that is a summary of what is a heart attack. And as a summary, remember, heart attack is death tissue, myocardial infarction, death of the heart tissue or necrosis. Lack of blood flow and oxygen is myocardial ischemia. And then angina is chest pain. Hopefully this video has helped you out. Leave a comment, like, and subscribe. Thanks for watching.